3, 2, 1.
Hi, I'm Dr. Matt Wiederholz, founding partner of Performance Spine and Sports Medicine. Welcome to this segment on the treatment of sacroiliac joint pain. Today we're going to be talking about the anatomy of the sacroiliac joint, sacroiliac joint pain and what that exactly is, and then the treatment of sacroiliac joint pain, including steroid injections, regenerative injection treatments, and simplicity. So the sacroiliac joint is a joint in the pelvis. It's made up of two bones, the sacrum, which is the butt bone, and the ilium, which is the outer hip bone. You've got one on either side of the body, and there are many ligaments that support the sacroiliac joint. Here's an X-ray depiction of the sacroiliac joint. You'll see here with the pointer, this line represents the sacroiliac joint. This bone here is the sacrum, and this is the ilium. And notice you've got an ilium on this side as well, and then there is the line representing the sacroiliac joint. This is a depiction of the vast ligamentous support to the sacroiliac joint. We've got the iliolumbar ligament, the posterior sacroiliac ligament, the sacrospinal ligament, and the sacrotuberous ligament. As you can see, there's a lot of support to the sacroiliac joint. It's a joint of stability. It's not a very mobile joint like your shoulder joint, but the sacroiliac joint has about 3 degrees of movement. So let's talk specifically about sacroiliac joint pain. Patients who experience sacroiliac joint pain usually describe pain in the buttock region. However, they may present to our office with lower back pain. The pain may radiate into the thigh or into the lower leg, and it's usually described as a dull aching pain. However, several patients do mention periods of sharp exacerbations. It's usually worse with changing positions or transitional movements. So getting in and out of the car may be quite difficult. Getting in and out of the chair, rolling in bed might be challenging and cause this pain. Here's a depiction of the referred pain pattern of sacroiliac joint dysfunction. You'll notice that posteriorly or in the back, there's buttock pain and thigh pain, and there may be pain in the lateral leg. And some patients will describe pain here anteriorly because the joint is three-dimensional, so you may have pain posteriorly and there may be anterior pain as well. Let's segue now into the treatment of sacroiliac joint pain. Number one, we do cortisone injections into the joint. This is a steroid preparation mixed with numbing medication that's injected into and around the joint to treat this pain. Often results in immediate pain relief, and the results typically are temporary. Next, we'll talk a little bit about regenerative injection therapy. We have two main forms of regenerative injection therapy. One is PRP, or platelet-rich plasma injection. This is an injection of growth factors that are derived from your own blood, from the platelets, and it regenerates the ligaments that support the joint. Prolotherapy, the other type of regenerative injection therapy, does the same thing, but instead of injecting growth factors from your own blood, we're injecting medications that stimulate the inflammatory cascade, and that is your body's way of trying to heal an injured area. Last, I'd like to talk about simplicity. Simplicity is a radiofrequency treatment of the joint. So what is radiofrequency treatment? It's a way for us to block the pain signals by interrupting the nerve supply to the joint. The joint is obviously innervated by various nerves, and that's where those pain signals are transmitted. This is performed with sedation in a surgery center, so very comfortable setting, and the results are usually rather fast, and recovery is quite rapid as well. This is a depiction of the Simplicity probe. This is the handle that the physician uses to position the probe, and then this is the radiofrequency element that, notice it's contoured, that's the shape of the sacroiliac joint, and that lays right on the sacroiliac joint in order to lesion the nerves that innervate the joint. Over time, those nerves will regenerate, on average about 6 to 12 months. The procedure then may need to be repeated if pain returns after those nerves have regenerated. And simplicity is covered by most insurance carriers. So to wrap things up, in conclusion, the sacroiliac joint is a joint within the pelvis made up of the sacrum and the ilium. You have one on either side of the body. Sacroiliac joint pain typically results in buttock and leg pain. The treatments may include physical therapy, chiropractic care, acupuncture, injections of cortisone or regenerative injection therapy, and simplicity or radiofrequency treatments of the sacroiliac joint. Simplicity is a safe and effective treatment for sacroiliac joint pain, and the results are fast. The procedure can be repeated if pain returns. I'd like to thank you for your attention and your time. If you have further questions or are interested in scheduling a consultation because you may be suffering from sacroiliac joint pain, please do not hesitate to schedule an appointment with me at Performance Spine and Sports Medicine, 609-588-8600. Visit us on the web as well. There's some additional presentations there, www.njspineandsports.net.